Hello, and welcome to the February 2024 edition of Room for Everyone, the video podcast of The Rheumatologist. Today, in the 2 or so minutes that we've got together, we're going to talk about time. The concept of time is so ingrained that it seems impossible to think there's any other way of thinking about it. A second passes here in Iowa, and a second passes there where you're listening. It seems like the same amount of time. But, believe it or not, there's much more diversity in the way we think about time. And that has important implications for our clinical practices and our patient-clinician relationships. To give a quick example, when you ask a patient about how long their morning stiffness lasts, it's not just a countdown of a symptom. It's a question that is based on a host of assumptions about how the patient experiences the time that they have had that stiffness. And by the way, it doesn't need to be in the morning if your patient's working third shift. Speaking of which, a major determinant of how we see time is whether we enter into what we call flow states, where time kind of freezes and you get to savor that moment instead of seeing it as work. You may have felt it before when playing sports or engaging in another hobby. How can we enter those flow states and pause time joyfully when we're in clinic or otherwise at work? Believe me, I can talk more and more about this topic, but I'm keeping an eye on the clock. So let me tell you what other great articles you can expect within this month's issue of The Rheumatologist. What should every clinician know about Ramadan and intermittent fasting? How can we honor our mentors like Dr. Rick Brasington and Dr. Robert Lightfoot? And how do we approach treatment when a JAK inhibitor fails? That and so much more in this month's edition of The Rheumatologist. So please enjoy. Take a seat, make yourself comfortable. After all, here at The Rheumatologist, it's always, now and forever, one for all and room for everyone. Happy reading.